Good morning. Good day. This is Sekou Radios in Sarasota, Florida. Today we have a great guest, friend and great doctor, Dr. Sadiq Elamin III. He's MD, PhD, MMS. Dr. Sadiq is a board-certified orthopedic surgeon specializing in sport medicine, shoulder, and regenerative medicine. He is the co-owner of the Elamin Orthopedic and Sport Medicine Institute. He is also Chief Scientific Officer at Biointegrated and Medical Director at the Northside Hospital Concussion Institute. He earned his medical school degree, MD, a master's degree in medical science, MMS, and a PhD in molecular and cell biology from Drexel University College of Medicine in Philadelphia, Pennsylvania. He completed his research fellowship in tissue engineering in the Department of Chemical Engineering at Drexel University. He received his orthopedic surgery training at the University of Virginia Health and Science Center in Charlottesville, Virginia. His resume is very big. I don't have enough time to read all of it. I'm going to have to ask him if I forget anything. Dr. Elamin, welcome to Sekou Radio.
Well, thank you, Sekou, for allowing me to be here, and thank you for that amazing introduction. Wow, man, it's a blessing.
Do you have anything to add to that resume there?
No, I just want to just. No, I woke up one day and realized that I'd done all these amazing things and just been blessed by God, and just to be able to just. I love science. I love science. I love medicine, and what you're seeing is, and what you're reading is just a cultivation of just that love and that passion that I have to help people and to stay on the cutting edge of science and bring the best thing to make this world a better place. And that's pretty much what it's all about. So, as you know, I'm very humble. I'm blessed. And everything I've done because with the good intentions of trying to make the world a better place, and it's really helped me out.
Yes, good point, Doctor. We would like you to go through the ABC or history of stem cell. What is the stem cell? Let's do a history of it.
Okay, so all right. So when you're born, your body sort of kind of, when you're a little what they call an embryo, and when the sort of kind of the egg and sperm come together, they form like a blastocyst or cell, and then you start to create life. During that process, you create cells that have the ability to make all organs. They can make bone, they can make tissue, they can make heart, liver, lungs, anything that's sort of kind of, they're like the generals of sort of kind of controlling that process. Those are called stem cells. And those stem cells go into various stages in your life. And we, as we grow up, we notice that we maintain those cells still in our body. So they're in the point as we're young, they're kind of still floating in our blood. They're in our bone marrow, some of them are in our fat. And as we get older, we still have those cells that have the sort of kind of the map or the sort of kind of directions on how to recreate or repair or remodel, or the term that we use is regenerate that tissue that's damaged. When, as you know, when you're young, you injure yourself or you have a scar, the next thing you know, it heals quickly. Well, why is that? Well, because the cells that grow quickly and turn over that are available are from that stem cell lineage. But as we get older, that decreases over time. And so I explain that stem cells are the cells that basically were there when you started life and are always there when and can sort of kind of recover and help you regrow. So I think there's a huge misconception that people think, oh, when you're dealing with stem cells, you're taking embryos and but that's not the case. No one's doing research on embryos. Stem cells are now, they're populated in your fat, they're in your bone marrow. They can be harvested from placental tissue or umbilical cord tissue, and they can have the ability to help you heal.
Right. Let's clear that controversy. People, when they hear the word stem cell, they seem to think that babies are being killed for this. That's not true, right?
Absolutely not. No, that's not. No. And I think in the earlier, when this first came out, 20 years ago or 30 years ago, people were like, oh my God, we're going to be growing all these test tubes of children, and we're going to be using them to harvest their organs and stem cells. But no, that's not true. No one's doing that. And to be honest with you, that's illegal. And if you know of anybody that's doing that, please let me know so I'll turn them in, because that's not what it's about. And I think that's a huge misconception, because it got a bad rep. But people who are in the business knows that these cells can be, that you carry them, I carry them, and the question of it is how do we find them, and how do we get them to a point to where they can be useful? And I think that's where the sciences now have caught up with the theories of being able to prove that wrong. That, I can isolate stem cells from your fat. I can isolate stem cells from your bone. And they may not be as potent as the ones that you had when you were small, but they still have stem cell qualities. It can still be helpful.
Good. Now you gave me a question. How you find them in a person and an adult? How you find stem cell in an adult? Yes.
I always tell people you don't find them, they find you, right? Because they know where to go. They've always gone there. They've been there. The question is, we never knew they were there, or if we knew they were there, we never knew how to isolate them. So there's pretty much two areas that are very high in abundance in what we call stem cells. And now, and let's step back a little bit. So when the stem cells actually are aligned as stem cells, right? So imagine them as like generals. Like you have a general of the Navy, you have a general of the Army, general of the Air Force, right? So you have stem cells that are particular stem cells that go to specific branches of the body. So let's take it for instance. I'm in the world of orthopedics. So what we use is what they call mesenchymal stem cells, which is mesenchymal meaning muscle tissue. So those are the stem cells that can become bone, they can become cartilage, they become neurons, they can become tendon, and they can go towards fat. So those cells are found in abundance in two areas. Those are found in your bone marrow. Typically they're harvested either from what they call your pelvic rim or your pelvic bone. Within the bone, the spongy bone inside there, you can harvest them from them. And then the second area is you can actually take them from your abdomen or what they call your what we call adipose tissue or your abdominal fat. They're also known to be within that area as well.
Right. So which one is the most common used, the bone marrow one or the one from your abdomen?
Well, that's a tough question because, it depends on the person. If you have a high profile athlete and he's got 2% body fat, he's not going to have a lot in his fat. Right? So that may be an individual where you may be harvesting them from the pelvis. Does that make sense? So, for instance, I just had a procedure where I had an athlete that is one of the top workout gurus in health and fitness. I call him an athlete because he competes at that level. He's been doing workout videos for the last 30 years. He is extremely in shape. He's got less than 4% body fat. So when he came down with having some knee issues and wanted to use regenerative medicine, I didn't have. I mean, he's got a 12-pack. There's no way I can harvest him from his abdomen. He's got nothing there.
Right.
So we took him from his pelvis. Isolated them and injected them back into his knee, and he did extremely well. Had no more pain, no more issues, and was able to get back working out and doing things that he loves doing.
So he has a knee issue. How you isolate the knee? Do you do some type of a MRI for that?
Yeah.
To determine what's wrong with his knee?
Right. So, I mean, what you want to do initially is you want to evaluate these individuals. I mean, you don't want to change what you do because of a person, right? As you know, I take care of a lot of high-profile athletes, and they, and people come in and they say, well, you're taking care of this guy. You got to just give him stem cells. You got to do whatever. And I say, no. You don't change medicine. Medicine changes for no one. When you change how you practice medicine for individuals, that's how you get yourself in trouble,
Right.
And so you typically still take them through the same regimen. You need to say, listen, first of all, let's get some x-rays. Let's see exactly what's going on. Make sure you didn't fall. Make sure you don't have a fracture. Make sure there's nothing going on. Make sure you don't have a huge bone spur or something that's different. Second of all, you want to say, okay, now that I got this, you want to do examination. You want to evaluate whether, because you don't know am I treating for a meniscus tear? Am I treating for a cartilage defect? Am I treating for a patella tendon issue? You don't know. So you still follow the same guidelines of medicine. So for me, I do an evaluation, I do imaging, and then I determine where your problem is. And if it's say for instance, I get an MRI, the MRI shows you have a huge cartilage defect in your knee and you have a loose body. I don't care what kind of stem cells you do, you're not gonna improve. So that's an individual you say, well, you know what? You may be a candidate, but right now, what's causing your pain, your locking, your catching, may be this loose body in your knee. So I need to remove that first, and then we can address the issue later. And why that's important, and I explain this to my patients simply like this. It's like a garden, okay? If you have weeds in your garden and you plant, new seeds, are you going to get a good harvest? No, you're not.
No.
You're not.
You're not.
They're not going to do well. You're not going to do well. And that's the exact same way you have to treat the body. So if you have loose bodies, all these fragments, you have tears, you got to clean that up first before you go in that direction. If you really want to do what's right by your patient.
Mm-hmm. Now, when the people do, like you said, we have a lot of famous people who come to you. When they do the stem cell, how long it takes to do a stem cell, and how long it takes for the recovery?
All right. So typically what I do is, like, again, once I figure out exactly what's going on, if they have, say for instance, let's take for instance, if they have like a sprain, an ankle sprain. I had a football player that had a really bad high ankle sprain, professional player, and he was supposed to be out for 6 to 8 weeks. And he came to me. We injected him within that ankle sprain area for that high ankle sprain, and he was able to get back in 2 weeks. All right.
Wow.
In fact, he played in the Super Bowl, did very well. And so, so we rested him for 2 weeks, make sure he was okay, make sure that we didn't do anything crazy, and then rehabbed him, got him back. But I had another athlete that had a partial pec tear in his arm, and he was supposed to be out a good 6 to 8 weeks. Possibly was looking at if it didn't get better, surgery. So we did stem cell therapy around his injury, and he's able to get back in 3 weeks. So but again, it's not that you just inject people and then you say get back. It's you still have to rehab them. You still have to follow the correct regimen. You have to make sure they're not doing things too much. And reason why that is because one of the things that makes stem cells so amazing